Depression is defined as feeling sad or gloomy with no apparent cause or reason behind the state of intense sadness. In fact, depression can interfere with people's lives for several weeks at a time. The causes of depression is believed to be a combination of stressful events and chemical changes in the brain. Sometimes this disorder is passed down through the genes, but it can occur in almost anyone. Even children and those not genetically predisposed to have the disease can be diagnosed with depression. Depression can be further influenced by stressful life events such as divorce and social isolation or alcohol and drug abuse. In fact, the medicines commonly used to heal some diseases can cause depression as a side effect. Since depression can be because of chemical imbalances in the brain, there are many options for therapists to choose from when treating this mental disorder. Here we will examine a classic case of depression and possible treatment options associated with it.
Hi Brian, how are you today?
It's not good. It's been a rough week.
What exactly brings you here today?
I can't seem to get much sleep. I can't stop eating. I have no energy. I can't concentrate. And things that interest me before now bore me. I've contemplated suicide multiple times, and I just feel hopeless.
Before we come to any conclusions, I would like to see what a typical day is for you. Okay.
Dad, what time is it?
5:30 p.m.
Oh, I had trouble sleeping last night.
Did you take your medicine?
No.
Oh.
No. Can I fly?
Get out of here, boy!
And that's what a typical day for me is like.
Well, Brian, you appear to have over 5 of the common symptoms of depression. Don't worry though, there are a variety of ways to treat depression, including prescription, medications, and cognitive therapy.
Can you explain them to me?
For drug therapy, antidepressants may relieve some of your depression symptoms, but they are rarely a long-term solution and can come with significant side effects. There are several types of prescription antidepressant medications that are divided into different classes. Each antidepressant class affects the levels of chemicals in the brain that are thought to regulate mood, known as neurotransmitters. There are two most commonly prescribed antidepressant classes. SSRIs are believed to treat depression by affecting the levels of a neurotransmitter called serotonin. These are generally safer because they cause fewer bothersome side effects. SSRIs include Prozac, Paxil, Zoloft, Celexa, and Lexapro. SNRIs are believed to treat depression by affecting the levels of two neurotransmitters called serotonin and norepinephrine. The side effects of SNRIs are similar to SSRIs. These medications include Cymbalta, Effexor, XR, and Pristiq. It could take as many as 6 to 8 weeks for the full therapeutic effect to occur. It is important to give the medication a chance to work and to take it exactly as directed by your healthcare professional. And there's also cognitive therapy.
Cognitive therapy is most commonly used to treat mild to moderate depression and is used when the therapist gets the patient to challenge negative thoughts. Developed in the 1960s, cognitive therapy was an innovative way to treat depression, operating on the underlying principle that thoughts influence mood. According to cognitive therapists, depression is maintained by constant negative thoughts that occur without a conscious effort. A depressed person might have automatic thoughts such as, "I can never do anything right." Although these thoughts can have a real source, the depressed person often exaggerates these points to fuel a sense of unworthiness. Under the use of cognitive therapy, a person learns to recognize and correct negative automatic thoughts. Over time, the depressed person will be able to discover and correct deeply held but false beliefs that contribute to depression. Cognitive therapy is praised for being cost-effective and highly successful. Depression demonstrates how the body and mind are closely related, because when someone is feeling down mentally, their body usually responds with lower energy and appetite levels, as well as a decreased quality of sleep. That's it. Depression can be somewhat prevented by taking part in group activities with people that have a positive attitude. Talking to someone such as a counselor or friend about how you are feeling, finding activities that make you happy, getting good exercise, maintaining healthy sleep habits, and avoiding the use of alcohol and illegal drugs.